Hey guys, my name is Ben. I'm that PT guy, and today I want to talk about frozen shoulder, specifically risk factors associated with this condition. Frozen shoulder is a disorder that takes place at the shoulder joint that limits the range of motion that occurs there, and it really leads to a very stiff, painful shoulder. And it greatly limits the functional and recreational activities of those that have the condition. And so this is something that nobody has time to or wants to deal with. And so my hope and my aim with today's video is that by sharing these risk factors, you'll be able to recognize if you are at a higher risk for developing frozen shoulder or not. And if you are, you'll be on the lookout for signs and symptoms associated with this condition. Remember, it is vital to seek early intervention if you do suspect that you're developing frozen shoulder. It will greatly reduce the rehab time, and it will reduce the severity of the symptoms associated with this disorder. So please, if you think that you're developing frozen shoulder, seek out a medical professional to get started with some treatments right away. So let's go ahead and dive right into the video here and look at some risk factors. Number one, age and gender is going to be a determining factor for whether or not you're at a higher risk for developing frozen shoulder or not. If you are a female, you are at a higher risk, specifically if you are a female between the ages of 40 and 60 years old. We aren't sure exactly why that is. It may have something to do with some hormonal changes between men and women, and for women during that age bracket as well. And so while not well documented why, women between the ages of 40 and 60 are at a much higher risk than men. Previous injuries are also another risk factor for developing the condition. If you have many repetitive injuries to the shoulder joint, that's going to leave you with a higher likelihood of developing frozen shoulder. Likewise, if you have had maybe one major traumatic injury at the shoulder joint, such as a motor vehicle accident, you're at a higher risk for developing this disorder as well. If you have had surgery, you are at a higher risk for developing frozen shoulder. And I don't mean just shoulder surgery, although that is obviously a real concern with every shoulder surgery. But besides shoulder surgery, any surgery that leaves you immobile, you have a higher likelihood of developing this disorder. Now, for the shoulder surgeries, you're probably at a higher risk of developing this, not only because of the immobility afterwards, but also because there's going to be scar tissue, probably adhesions, and so there's a physiological change that's occurring at the shoulder joint, and that will leave you at a higher risk as well. Diabetes is actually a major risk factor when it comes to developing this condition. Frozen shoulder affects about 2% of the population as a whole. That jumps up to 10 to 35% with those who have diabetes. And so if you are diabetic, you are at a much greater risk for developing frozen shoulder than those that don't. People that have hyperthyroidism also are at a higher risk. Cardiopulmonary disorders, neurological disorders, even personality disorders are associated with developing this condition. Autoimmune diseases and even cardiovascular accidents or strokes are associated with developing frozen shoulder. It's not well documented in a lot of the literature, the why for some of these risk factors. However, they have been shown to be real contenders with predicting who may develop this disorder. Now, with risk factors, it's important to remember that usually one risk factor is no cause for alarm. However, if you have 1 to 2 to 3 and you start adding up these risk factors, you are going to greatly increase the probability of developing frozen shoulder. So if you have these risk factors, it's important to keep an eye out for the signs and symptoms of frozen shoulder. And if you start developing these signs and symptoms, always seek out a licensed medical professional. And remember, I am a licensed physical therapist, but I'm not your physical therapist. So always seek out somebody first. All right, so that wraps up our video today on the risk factors associated with developing frozen shoulder. I hope it was beneficial to you, and we'll see you again in the next video. Thanks for watching.